Thank you, Mr. Chair and Ranking Member, and thank you to all of our panelists for being here today. Governor Beshear, I am sure that you've seen firsthand, just as I did as governor of New Hampshire, all the benefits that the ACA led to in your state, and I reviewed your testimony, and I understand that that's what you talked about in it. From one governor to another, I can tell you how much the ACA has helped my state of New Hampshire. Approximately 55,000 Granite Staters have coverage under the state's bipartisan Medicaid expansion. 49,000 have private coverage through the exchange. But I truly worry that Trump Care and efforts to sabotage the ACA, I worry about how those changes will strip access to care for tens of thousands of Granite Staters and how it will increase costs. I also worry about how efforts to repeal the law will impact states' bottom lines, including efforts to repeal Medicaid expansion and the efforts to turn Medicaid program into some sort of a block grant program. That would leave people uninsured, it would slash federal funding, and shift costs to states, putting pressure on what in most states are already very strained budgets. So I'm not the only governor who's expressed this concern. Press reports show that Republican governors share my concerns. According to Politico, at least 5 of the 16 Republican governors of states that took federal money to expand Medicaid are advocating to keep it, or they're warning Republican leaders of the disastrous consequences if the law is repealed without a replacement that keeps millions of people covered. So, Governor, your state expanded Medicaid. As I understand it, an estimated 151,000 Kentuckians have health insurance today because Kentucky expanded Medicaid. And in all, your state has more than 1 million people on the Medicaid program. So what would it mean for a state budget like Kentucky's if some of us here in Washington get their way and the Republicans repeal Medicaid expansion and turn Medicaid into a block grant?
Well, first of all, turn it into a block grant, and you can pretty much write off a whole lot of people in your state in terms of getting coverage, because it is a Trojan horse. It sounds great, flexibility. And as you know, having been a former governor, your eyes light up when you hear the word flexibility. But then when you open that horse up and you see, I'm getting half the money to do the program that was going to be done, and it's going to be up to me to cut people off and to cut benefits. And it looks like Congress is pulling the Pontius Pilate routine, and washing their hands of all of our folks and blaming it on me. So that's a non-starter, and that would be a disaster. Our state obviously was benefited tremendously by expanding Medicaid and by the Affordable Care Act. But not only in quality of life and quality of health, economically, it has been a boon to us. And this is not Steve Beshear talking. This is PricewaterhouseCoopers. Right. This is Deloitte Consulting, who did studies. And PricewaterhouseCoopers, before I expanded Medicaid, I asked them, I said, you got to tell me what this is going to do to me or for me, because I got a budget to manage. Right. They came back in 6 months and said, Governor, you can't afford not to do this because it's going to be so good for your state. Deloitte came in a year later and looked at actual data. We'd already created 12,000 new jobs. You're going to create 40,000 overall. It's going to have a $900 million positive impact on the state budget over 8 years. It's a no-brainer. It's a no-brainer both from the health of your people and from the budget that you got to operate.
Well, thank you. And thank you again for being here and for your work for the people of Kentucky. Ms. Tavenner, I also had a question. It's clear that those who want to do away with the ACA haven't been able to come up with a plan to replace it as of now. And they've laid out a roadmap, though, how to repeal it. As you know, in 2015, Republicans passed a budget reconciliation bill that repealed major parts of the ACA. It was vetoed by President Obama, but had it been signed into law, it would have had devastating impacts. It would have made the risk pools sicker. It would have stripped away premium subsidies, which help people afford their monthly premiums. In New Hampshire, more than 31,000 people get these subsidies, averaging $261 a month. So if Republicans were to pass a bill similar to the one they passed in 2015 this year, won't premiums on the individual market skyrocket?
First of all, I think that what we would want to see is that we would work with, you could call it repeal, replace. These two need to travel together.
Right.
So we need to understand, as the changes are made, what's the length of time for the changes, and there are some improvements that can be made And earlier, when we were talking about executive orders and things such as special enrollment periods could be handled today, grace periods could be handled today, and have immediate benefit in terms of some relief of premium and uncertainty and keeping people in the market and not using it as just in time. The devil is going to be in the details. The message that we're sending today is we want to work with you to have a logical way to move to make improvements in the individual market. It has been challenged. It is undergoing some unique challenges today. There are low-income people who cannot pay co-pays and deductibles, so there are improvements to be made all around. That's what we want to see.
Well, and certainly I think there isn't anybody up here who doesn't agree that there are flaws that we need to work on in the ACA. But what we are trying to point out is that just a straight-out repeal destabilizes the market. And I just note that before the ACA came along, when I entered the state Senate in New Hampshire, we were seeing insurance premiums skyrocket, and we were seeing insurers leave our state. Since we passed the ACA and passed bipartisan Medicaid expansion, because we did it in a market-based way, we've attracted new insurers into our markets, and more people are covered. So I appreciate your willingness to work. My biggest concern is that we'll just that the current plans from the majority seems to be just to repeal without a replace plan. Thank you.
Thank you, Senator.